The cardiac electrical conduction system and its EKG or ECG representation. The electrical conduction system of the heart is a complex network of specialized cells responsible for generating and coordinating the electrical impulses that regulate the heartbeat. This system ensures that the heart contracts in a coordinated and rhythmic manner, allowing for the efficient pumping of blood throughout the body. The electrical activity of the heart starts from the sinoatrial node or SA node. The SA node is the natural pacemaker of the heart. It is located in the right atrium near the opening of the superior vena cava. The SA node initiates the electrical impulses in the heart to generate regular action potentials, creating the heartbeat or rhythm. The electrical impulses travel from the SA node and spread rapidly through both atria, causing them to contract or depolarize to pump blood into the ventricles. The atrioventricular node or AV node coordinates contraction between the atria and the ventricles. It is located in the lower part of the interatrial septum. The AV node is also known as the gatekeeper of the heart. It causes a brief delay in the transmission of electrical impulses from the atria to the ventricles to allow the atria to contract and fully pump all the blood into the ventricles before the ventricles contract or depolarize. After the brief delay, the AV node transmits the electrical impulse to the bundle of His, which further conducts the signal to the left and right bundle branches and the Purkinje fibers and throughout the ventricles, leading to coordinated contraction of the ventricles. The bundle of His is made up of special fibers that transmits the electrical impulses from the AV node to the ventricles. The bundle of His is located in the interventricular septum, dividing into the left and right bundle branches. The Purkinje fibers are terminal branches of the left and right bundle branches from the bundle of His that extend throughout the walls of the ventricles. They transmit the electrical impulses to the myocardial cells of the ventricles, causing them to contract. The ventricular depolarization or contraction pumps blood out of the ventricles into the pulmonary artery and aorta for distribution to the lungs and other parts of the body. In summary, the SA node generates an electrical impulse. The electrical impulse spreads across the atria, initiating atrial depolarization or contraction. The electrical impulse is delayed at the AV node to allow the ventricles to fill with blood. The impulse travels through the bundle of His to the bundle branches. The Purkinje fibers transmit the impulses to the myocardial cells of the ventricles, causing ventricular depolarization or contraction. The coordinated contraction of the ventricles results in the ejection of blood into the pulmonary artery and aorta. This intricate electrical conduction system ensures the synchronized and efficient contraction of the heart, maintaining an effective circulation of blood throughout the body. Any disruptions in this system can lead to arrhythmias or other cardiac conditions. Electrocardiogram, also known as ECG or EKG, provides valuable information about the electrical activity of the heart. P wave represents atrial depolarization or contraction. This typically takes about 0.08 to 0.10 seconds with about 2.5 mm amplitude. The PQ segment or PR interval represents the time it takes for the electrical impulse to travel from the atria to the ventricles, and the normal duration is typically 0.12 to 0.20 seconds. The QRS complex represents ventricular depolarization or contraction and takes about 0.12 seconds. The ST segment represents the early part of ventricular repolarization or relaxation, which typically occurs between the QRS complex and the T wave. The T wave represents ventricular repolarization or relaxation. This takes about 0.20 seconds. Overall, a normal echocardiogram suggests that the heart is functioning within expected parameters, with normal chamber sizes, valves, contractility, and blood flow. It is important to note that the interpretation may vary based on individual patient characteristics and medical history. Thanks for watching.